Uh, Good afternoon. I'm Dr. Gauthami Nagabhirava. I'm a consultant psychiatrist. Today, I'd like to talk to you about anxiety disorders. So, it's important for us to recognize that anxiety is a normal biological mechanism. It is necessary for survival. So, anxiety protects us from dangerous situations and it helps us react faster in such cases. So, for example, in any sort of life-threatening situation, imagine if there's a dangerous animal, the anxiety will leads to a fight or flight response, and we either fight the animal off or we tend to run away, right? So that's the fight or flight response. Similarly, in the COVID pandemic, most of us were afraid for our lives, and so we practiced social distancing as well as we practiced the guidelines that were given to us. And the reason for this is because we were worried about our lives. Similarly, children who have exams let's say a child has an exam tomorrow, because they're worried, they study for their exams. If not, they'd be watching movies. So anxiety, the right amount of anxiety is actually helps us with performance. So right amount of anxiety improves performance, optimum anxiety, optimum performance. But when anxiety becomes too much or it's excessive, then that leads to problems, right? Now, the various kinds of problems, anxiety, and that's when we say that these are known as anxiety disorders. So, anxiety disorders are when there's excessive anxiety and that disrupts a person's day-to-day functioning. They're unable to control themselves around situations and they overreact to situations, or they have trouble responding to in that situation. Right? So the various types of anxiety disorders that are very common are known as include generalized anxiety disorder, panic disorder, specific phobia, and social phobia. So when we talk about generalized anxiety disorder, here an individual often tends to worry excessively and unreasonably for normal day-to-day activities. So in this case, we have, for example, it could be work, it could be school, it could be their relationships, right? And the person tends to have symptoms such as restlessness, feeling irritable, they have maybe trouble sleeping, difficulty concentrating, muscle tension, fatigue. This is generalized anxiety. And the individual, the patient knows that these are, often knows that these are unreasonable, excessive, but they're unable to control themselves. Similarly, another psychiatric condition which often troubles and distresses patients is panic disorder. So when we talk about a panic attack, it's a sudden, intense episode of anxiety that often lasts for a few minutes, for seconds to minutes. It rarely exceeds beyond 30 minutes. That's so just a sudden episode. And in this, often the patient will have symptoms, both physical and psychological. And the physical symptoms range from absolute terror, where the patient feels like they're almost dying. Apart from that, the patient will have palpitations, sweating, tremors, chest pain, difficulty in breathing, sometimes lightheadedness, giddiness, nausea, vomiting, a sensation of choking, heavy pressure on the chest, so all difficulty breathing. All of these are symptoms of panic attacks. And as you can see, if somebody is facing these symptoms, then it is highly distressing. The patient may even believe that they're having a heart attack, or they may feel as if they're losing control. So often such patients will not come to a psychiatrist. They'll go to a cardiologist or even the emergency room because they feel like they're dying. Often there is effective treatment, often these cases are missed. Now, one or two panic attacks, it's not a cause for concern, but when an individual continues to have repetitive panic attacks, then that's a problem and it becomes a panic disorder. And in such cases, when someone has a panic disorder, that also leads to lifestyle changes. Now, the lifestyle changes could be avoiding places where they've had panic attacks in the past, and then this leads to further disruption in day-to-day activities. Other anxiety disorders that are common include social phobia or social anxiety and specific anxiety disorder. right? So we all know about the various lists of phobias, I think, but generally a phobia is when an individual has a fear, right? An intense fear. Sometimes the fear is makes sense. For example, fear of snakes, and sometimes the fear doesn't make sense. But always it will be excessive. The level of fear will not match the situation. And so, in such cases, even the thought of the situation leads to intense. Again, it could trigger panic attacks, and often the individual will disrupt their day-to-day. Will start avoiding. So the avoidance behavior kicks in, and this leads to various lifestyle changes. Again, which disrupts their day-to-day functioning. Always in psychiatric problems, we tend to see how is it affecting the patient? Is it disrupting their day-to-day functioning? Right? For example, if somebody has a fear of flying, then obviously it's going to disrupt their life. It's going to affect the kind of jobs that they may choose, right? And it's going to affect their relationships, everything, right? Similarly, another common condition is social anxiety disorder. As the name suggests, the patient or the individual tends to have difficulty in social situations. The patient may feel anxious, they may feel self-conscious and embarrassed in social situations. And the underlying thought behind this is mostly that they feel as if people around them are judging them negatively or scrutinizing them. And so they have trouble in new situations. They have trouble even in harmless things like eating in front of people, talking in front of people. Sometimes, not that every single person has to have the same symptom, but in new, unfamiliar places, they will have a difficulty. And also in performance, there could be a specific type of performance anxiety as well, giving presentations or talking in front of the entire class. Right? So the patient feels conscious and the individual tends to feel conscious and embarrassed. And again, this leads to the avoidance. Now, any anxiety, any fear, the more we avoid, the anxiety tends to worsen. It doesn't help, right? So the avoidance will lead to further anxiety and further worsening of the fear. So in social anxiety, the individual tends to avoid social situations because of the fear. It's important for us to also understand why these disorders are there, right? So anxiety disorders are caused by multiple factors. So these include biological factors, psychological, and social factors. So we call this the biopsychosocial model. So biologically, it's genetics, it's a neurochemical imbalance. It could be the person's personality, their attitude, and also their beliefs, the way they've grown up. Right? If an individual has seen their mom and dad react anxiously for every situation, they may learn that behavior as well, right? And then situations themselves. So all three things together cause the disorder. What we do need to understand is that if someone has anxiety, it doesn't mean that they're mentally weak or that they're not strong enough. Yes, the individual understands that, so it doesn't really help if people around them say, stop being so anxious, just start thinking positively, right? Just like we wouldn't blame a person with hypertension or diabetes or someone with a fever, we wouldn't ask them to, reduce their fever on their own. Oftentimes when the anxiety is very severe, it doesn't help to say, stop worrying, right? Because the individual may understand the theory behind it, but they have difficulty controlling that worry, right? And that's natural. Again, it has nothing to do with a personality flaw or a character defect, right? And so we need to stop shaming people who have anxiety, right? Apart from that, another problem that anxious patients often face is that many people believe that anxiety only means psychological symptoms, but there are a lot of physical symptoms, and I have spoken a bit about the physical symptoms so generally, there are about 100 physical and psychological symptoms as well. So the most common ones, again, are palpitation, sweating, tremors, right? Difficulty breathing, fatigue, restlessness, difficulty concentrating, trouble sleeping, muscle tension, aches, pain. So all of these can be symptoms of anxiety. And often the individual will not know, and they'll go to multiple doctors before they're referred to a a psychiatrist. So generally, any unexplained physical symptom that isn't matching will be generally may have a psychological cause that needs to be evaluated, right? And so when we have these warning signs, right? So it's very important that the patient or an individual who's struggling with all of these symptoms, they must come see a psychologist or a psychiatrist. Now, when we talk about the treatment for anxiety disorders, treatment again ranges from medication to therapy. Now, there is a common misconception among the general public that any individual who comes to see a psychiatrist will be forced medication or will be given medication that is harmful, dangerous, which is not true, right? So the medications are absolutely safe, they're effective, and you don't need to take them lifelong. It depends, right? It depends case to case. They're not addictive. So we give various classes of medications, which include antidepressants, which work both on anxiety and depression, and then other medications which help relieve anxiety. So apart from that, we do have a therapy, cognitive behavioral therapy, that helps patients deal with anxiety situations, relaxation therapies, right? So all of these are mostly talk therapy to help the patient deal with the anxiety and correct any irrational beliefs that they may have, irrational negative thought that they're having. And so that is what the therapy is focused on. So these are the two options. The psychiatrist will never force one treatment over the other. It's always after discussion with the patient that the treatment is chosen. Right? Thank you.